For over 50 years, Zambia and China have shared long-standing diplomatic relations. These relations have existed since October 29, 1964. Since then, the two countries have seen a consistent development process. Zambia has benefited significantly from China in the political, economic, and trade areas through various projects. Politically, in the early 1960s, China provided active support to the Zambian government in its efforts to consolidate political independence and struggle against Western colonialist control. Additionally, in the economic and trade spheres, China has undertaken 35 aid projects such as the Tanzania-Zambia Railway Tazara, the Tuta Bridge in Northern Province, two ultra-modern stadiums, the Levi Mwanawasa and the Heroes, road projects, among others, in the last 50 years. In the health sector, China has contributed to the enhanced provision of quality health in Zambia by sending 19 medical teams with a total of 515 doctors and experts to Zambia since 1978. Since achieving socio-economic development is partly attributed to a strong health system, government has placed high premium towards achieving health care for all Zambians. To help realize its quest of delivering quality healthcare services to the citizenry, government has made significant strides to achieve this goal. Some of the achievements include the massive rehabilitation works on Zambia's highest referral hospital, the University Teaching Hospital (UTH), the construction of 650 health posts across the country, and the upgrading of major clinics such as Chilenje and Matero to first-level hospitals. Furthermore, government has yet again recorded a milestone in the health sector through the imminent construction of the specialized hospital in Lusaka, which will provide services in cardiology, neurology, orthopedics, nephrology, spinal, transplants, and rehabilitation. President Edgar Lungu officiated at the groundbreaking ceremony of the construction works of the specialized hospital on 17th October 2017. The facility will lie on a 12-hectare piece of land in the east of Lusaka off the Kenneth Kaunda International Airport Road in Chongwe constituency. Lusaka Province Minister Jafen Mwakalombe, who is also Chongwe constituency Member of Parliament, is happy with the massive infrastructure development taking place across the country.
Today, Your Excellency, you have already started putting the people, money in the people's pocket. This infrastructure, Your Excellency, that we are witnessing, which you are launching today, has saved and will save Zambian people's money and put that money in their pockets. As a provincial minister, Your Excellency, I want to thank you on behalf of the people of Lusaka Province, that Your Excellency, your kindness, your truthfulness should be emulated by all of us who are following Your Excellency. Chongwe is benefiting massive infrastructure development.
The value of the project, which is a loan, is worth 159 million United States dollars and includes the designing, construction and equipment.
We will not share Your Excellency from doing that which benefits the majority Zambian. A lot of people, Your Excellency, have lost their lives because of challenges of having specialized treatment going abroad. But today, under your leadership, you are the first sitting president in Zambia to do that which you are doing today. And Your Excellency, I want to say they will not be happy. They will try everything possible to frustrate, but will not be, because we know that the Zambian people are with you, the Zambian people are with us, and the developments that we are bringing are demand-driven, are developments that have been yearning for so long by the Zambian people. I'm aware, Your Excellency, that the hospital, the specialized hospital that will be launching today, immediately after I invite you, it was supposed to be built one big hospital inside. Now, because of equity, we decided to split it into three. We have the general hospital being built in Chinsari, another one being built in Petauke. This one is a specialized hospital that will be able to deal with all the necessary conditions that attack, the heart attack, urinal, and any other specialized treatment, Your Excellency.
The contractor, China National Engineering Company, said the project will be completed by the end of the year 2020. President Lungu was guest of honor at the groundbreaking ceremony of this unique specialized hospital, which is expected to spur health tourism.
This, as we have already heard, is a landmark in my government's quest to improve healthcare services for our people. In our 2011 manifesto as Patriotic Front, we made a commitment to the people of Zambia to make infrastructure development as one of the key priorities in the transformation of our economy. Good infrastructure is a prerequisite to the attainment of sustainable social and economic development. The results are therefore all to see. Indeed, we are walking the talk in fulfilling our manifesto promises, not only in upgrading the health sector infrastructure, but across other areas too. We are not moved by the insensate criticism by those who seek to scare us away from delivering on our promise. Let me echo what Honorable said. We are focused on what we promised our people in the last 3 major elections we have won since 2011.
Once completed, the health facility will cater for not only Zambians, but also the Southern African Development Community SADC region and beyond.
I'm delighted to be at this groundbreaking ceremony for the first ever public specialized hospital in Zambia, proposed to be named Lusaka Specialized Hospital. Of course, this is subject to full consultation. Today, we can attest to the many infrastructure development milestones your government has executed since 2011. Ladies and gentlemen, the Lusaka Specialized Hospital will offer healthcare services not only to Zambia, but also to the SADC region and beyond. Among the services to be provided will include cardiology, neurosurgery, orthopedics, neurology, spinal services, transplants, and rehabilitation services. If we ever to come to South Africa, to India, to Palwa, so this time now, this thing will be done here. We've already explained the benefits that will come with this. Obviously, people will come and seek help, treatment from Zambia. They will stay in our hotels. They will use our transport system. That is tourism. It's called medical tourism. And there will be money coming. When they say there will be more money in the pocket, they are not dreaming. This is what we mean by more money in the people's pocket. The construction of the Chinsari General Hospital, the Lusaka General Hospital, the Lusaka Specialized Hospital, and indeed other health facilities is timely because my government has taken a huge step to reduce the disease burden, especially for non-communicable diseases. I have no doubt that these facilities will improve access to quality health services.
Furthermore, the health facility will ensure that Zambians have access to specialized medical services, thereby reducing costs that are being incurred to access health services abroad, as Minister of Health explains.
Your Excellency, you continue shaping your legacy and staying the course in improving the health of the people of this country. And you span the continuum of care. Your Excellency, you are a champion of wellness. You launched the National Wellness Day and you've provided leadership in ensuring that people are healthy. Your Excellency, you introduced the TPMA in this country to protect people from HIV. Today, you've gone to another level, Your Excellency, adding to the continuum of care, increasing access to specialist services for the people of this country. Your Excellency, we would like to say thank you for honoring what you pledged to the people of this country, that you're going to maintain their health.
Children will also benefit from the facility once it is completed.
Your Excellency, today you till the ground to signal commencement of construction of the first specialist hospital in Lusaka. Organ transplant is assured for the people of this country. Our children of this country will now be serviced without being flown out. Your Excellency, medical tourism, which will attract people from the region, will create new revenue streams for the country.
The benefits which are expected to be reaped from the specialized hospital include human capital and resource.
Your Excellency, human capital development, not only for Zambia but for the region, will be enhanced by this infrastructure you're planting here today.
And UTH Superintendent explains the importance of having such a facility in the country.
The healthcare system actually runs through a number of phases. So you've got the primary care, you've got the secondary care, then you've got the tertiary and the quaternary care. When you look at the specialist services, then they have to fall into the tertiary and quaternary care. And UTH falls into, University Teaching Hospital falls into the tertiary and quaternary care. And we offer specialized services, quality specialized services. And looking at the needs of the community, that's where we tell which centers of excellence we are going to build.
How different will this facility be compared to the UTH?
Looking at Lusaka Specialized Hospital that has come onto board, I think people should understand that it's going to complement the services that we offer in different fields of specialization. University Teaching Hospital is offering specialized services, like if you have to talk about in cardiology services, orthopedics services, infectious disease services, cancer disease services, and the Lusaka Specialized Hospital will also be offering in those services, and it will complement the services, because looking at the need, we cannot cope as University Teaching Hospital alone for the number of cases that we have. And that's why there is need to build more specialized hospitals in different localities of the countries. And the need within Lusaka is just too huge to be absorbed by the University Teaching Hospital. So basically, it will complement what we are doing.
The facility will house an outpatient department with the capacity to receive 200 patients per day and attend to 80 emergency cases per day. Additionally, the hospital will also have a capacity of 121 bed spaces, 33 nursing rooms, and 6 surgery rooms, and a landing bay for helicopters that will be airlifting patients. Chinese ambassador to Zambia, Yang Yumain, stressed the cooperation Zambia and China have shared over the years, as the two countries have great potential for future cooperation in the area.
As we all know, that China and Zambia share a profound traditional friendship and enjoy a time-honored history of cooperation in the area of public health. Since 1978, China has sent 19 medical teams with a total of 515 doctors and experts to Zambia. They have provided, within their ability, high-level and high-quality medical service to the Zambian people. The Chinese side has helped the construction of the Levi Mwanawasa Hospital, which under the China Aid program. Last June, Chinese State Councilor, His Excellency Mr. Wang Yong, attended the groundbreaking ceremony for the expansion project of the hospital, together with Honorable Inagawina, Vice President of the Republic of Zambia, during his visit to Zambia. The hospital to be expanded from 150 to over 800 beds.
China National Complete Engineering Corporation, the company engaged in the construction, first arrived in the country in 2011. It is a renowned construction company that has implemented a number of projects in Zambia.
China National Complete Engineering Corporation is a subsidiary of China National Machinery Industrial Corporation, which is affiliated by the State-Owned Asset Supervision and Administration Commission of the State Council, ranking 293 on 2016 Global Fortune 500 list and 24th on ENR's top 250 Global International Constructors. China National Complete Engineering Corporation has over 180 branches abroad and has contracted projects in more than 40 countries in Africa, Asia, Eastern Europe, and South America. China National Complete Engineering Corporation successfully entered the Zambian market in 2010. We successfully implemented the construction of housing units for the Ministry of Defense, and we also further signed contracts for the construction of 3 hospitals across Zambia, a Fulafuta water supply system, and upgrading of 4 airports. China National Engineering Corporation has integrated the world's best design units and equipment suppliers for these projects, and has taken the lead in introducing Building Information Modeling, or BMI system, an intelligent 3D model-based process which enables architects, engineering and construction professionals to be more efficient in planning, designing, construction and management of these projects. We will ensure that we implement projects under the unified requirements of Ministry of Housing and Infrastructure Development and the Ministry of Health, and maintain a high sense of responsibility to the Zambian people to fulfill corporate and social responsibility. In order to complete this project to quality standards, China National Complete Engineering Corporation will adhere to the safety regulations, and we are committed to follow the obligations and conditions of the contract and the environmental impact assessment decision, and indeed any laws and regulations of the country.
总统阁下，再次感谢您对于本项目的支持。
The construction of the specialized hospital will have a ripple effect on the local community through job creation directly and indirectly. Since the empowerment of local people has remained a priority on government's agenda, the head of state called on the Ministry of Housing and Infrastructure Development to ensure that local people are empowered.
This hospital will be built at a great cost, hence will require very specialized skills during and after construction. I urge the Ministry of Housing and Infrastructure Development to ensure that as much as possible, the subcontractors and suppliers of material should be our local citizens in order to empower and build capacity in our people. I also wish to appeal to the church, faith-based organizations, civil society, and indeed other players in the health service delivery system who have, over the years, partnered with government to provide quality health services to journey with us as we execute these projects.
In order to enhance the fight against HIV/AIDS, as the construction of the hospital is underway, the President directed both the Ministries of Health and Housing and Infrastructure Development to formulate a policy to mitigate the disease.
I wish also to direct the Ministry of Housing and Infrastructure Development to work in conjunction with the Ministry of Health to formulate a policy which should be a prerequisite in all contracts to state how the consultant or contractor intends to help mitigate the spread of the HIV virus during construction. I'm saying this because I know most people who come to work here leave their families behind, and they come as singles. And the age to find partners is inescapable for some people. So please help us address the issue of HIV virus transmission during the construction of this project. Because I know that the children are welcome. The children are welcome, but the disease is not welcome. I'm prompted to say this because wherever there is a project of this magnitude, people come from various places, and whenever this is so, it is imperative that we are proactive in ensuring that our people are protected from the HIV/AIDS scourge. I'm not ashamed to say this because I know it's true, it's real, it's there. If you don't get sick and we don't know about it, we'll know you by the product of your stay here.
China National Engineering Corporation donated medical supplies.
Gentlemen, on behalf of China National Complete Engineering Corporation, we would like to have a humble contribution of assorted medical supplies, worth about 200,000 kwacha to a health center or health centers of your choice.
Because traditional leaders are key in the development process, Senior Chieftainess in Komesha, Mukamambo II, attended the groundbreaking ceremony and expressed gratitude to government for the investment within her chiefdom.
The people that have been sent out of this country for specialized treatment abroad are so many, and the cost to that has been huge. But for this hospital, Your Excellency, that you are launching, and we are waiting that one day in 2020 we'll be here for you to commission the opening of this hospital. I just pray to my God to sustain my life, that probably in 2020 I should still be around to witness the official opening of this hospital. I am encouraged myself, and I am very happy as a traditional leader to stand before you, the audience that are here, that I am part of you, witnessing the commissioning or the groundbreaking ceremony for this project, because it is very, very important to the people of Zambia, and not only those from Lusaka province. As you have said, Your Excellency, the issue is that I've been told, we heard that other general hospitals are being built in various provinces in the Republic of Zambia, about 3 of them to support this one. And this one, Your Excellency, is unique in its own case, because even from all those areas, there will be complications of diseases that will not be managed to be contained by those hospitals. They will come here. And this makes this hospital unique in its sense. I also want to say that the money that you are going to save from sending people abroad for cases that could have been done locally in Zambia, you are going to retain it, Your Excellency, to develop other activities, other projects in this country. For this, I am very happy, and I give you my hands, Your Excellency. Continue. You are the President of the Republic of Zambia.
The construction of the Lusaka Specialized Hospital project is a key step to improving the availability of quality healthcare services and the development of medical resource in the country. Therefore, the project is a landmark achievement in the history of the health sector in Zambia and is a reflection of government's commitment to the delivery of health services, as a healthy nation is a wealthy nation.